got the book in the mail. This looks so great. And I'm so excited to pick your brain a little bit about your most recent third edition of Behavioral Consultation and Primary Care, Guide to Integrating Services. So one of the things I want to ask you was, what gave you the inspiration and the motivation to come out with the third edition? Because there was such good content in the first and the second one.
I know. It actually, was, we started working on this after the pandemic. And, integrated care had reached a real tipping point, I think, where more and more people were interested, reaching out, looking for instruction. Yes, and then Jeff and I were so amazed by the people we were partnering with and working with and learning from. And there was just a time of so much innovation, 20, 21, 22, 23, 24, and we're like, we have to write this down. There's so much new stuff. So even though we left out over half of the book from 2017, it's still available. The other one too. In fact, you can get free chapters on the book website of the first, which has more clinical things that are still relevant. But it was that sense that, we want to share this, what we've been doing, what we've been learning from others, because there's so much innovation and science.
And was that like a lot of your consulting work and working with organizations and just people just kind of reaching out, asking questions, and as you started working with organizations, you kind of started innovating, and it was like that wasn't found in this first or second edition, so we have to write it down in the third.
Right. Yeah. I mean, there were innovations for sure between the first and the second, but a lot between the second and the third, and some of the big projects like New Zealand, 7 years on, was a really big deal.
Yeah.
But the Department of Defense going worldwide and that scale up. And then just a lot of innovation looking at how to better meet the needs of people living in rural areas. And so we tried to take everything we're learning from, certainly, people we're partnering with, but people that we're learning from that are innovating in their own right.
Yeah.
And try to make that all available in one book.
Yeah, so, I mean, I've always been really enamored with that whole process. I got to talk to Jeff separate, not on camera, about his experience, and it was like, well, how do you know what to keep in? How do you know what to add? And then, so is there do you have a secret to writing it?
Well, definitely we kept the core competencies and the model definition. We gave more information about program evaluation, a lot of information about training to competency, training leaders like clinical leads and managers and all members of the team, medical assistant, practice manager, the leadership team. How do we kind of bring everybody up together in their skills for this really new approach?
And would you say, for those who may be watching this and aren't overly familiar with all the three editions, would you say that this third edition has more of that higher level view to where you're taking into account the entire healthcare organization? Okay.
Yeah, so in the second edition, we had a competency tool for primary care providers and nurses. In this version, we have a core competency tool for primary care providers and team members.
I see.
So it's very broad, and our revised core competency tools only have two areas. One is clinical skills and one is team-based skills. So skills for working as a member of the team. And they have a lot of the core competency tools have behavioral anchors, they have scripts, they have all kinds of information all-in-one tool, which, by the way, you can get without buying the book. All you have to do is go to the book's website. And the easy way to get to that website is speaktoyourdoctor.com. So we decided to buy that URL and point
I was wondering about that because I was reading your Medium and
so this is the deal. You know, now more than ever, we need all hands on deck to make healthcare better. So that includes people in the community. Primary care is a community endeavor at its best. It's like, I want my community to be well. I want to be a part of it. I want my family to be a part of it and our families to be connected. So we wrote an information sheet, and I've published it other places too, Medium. But it's just an example, and you can get it on the book website under the tab speaktoyourdoctor.com. And it says, you know, if you have a primary care provider, schedule an appointment, go talk to them.
Yeah.
These are some things you could say.
I saw that.
If you don't have one, then get one and talk to them. And, you know, tell
That's
them
a cool
what
population-based approach right there.
Yes, it certainly is. It certainly is. And the bottom half of the page is, if you're a primary care provider and you don't have primary care behavioral health services in your clinic, these are some things you could do. So
wow. So you have both the comments for the patients for what they can start asking of their primary care providers, and then also some facts for the primary care provider about how to, like, what to do if you wanted
just
more
one
behavioral
piece
support.
of paper. You can take it on your phone or you can print it out, and you've got those examples there that you can refer to. It can be a 5-minute conversation, and then the actions that the primary
What
care
gave you guys, now I'm curious, what gave you guys that idea of going kind of, I know Dr. Strassel's with us too, you guys can't see him, but one of the things that he would always say with the residency clinic that we were at is that when you are able to be a BHC at the residency clinic and they can go out to their practices, they're going to be beating on the drums of PCBH and saying, demanding that from their employers and future employers and saying, this is something that I would expect, is that you would have some of this support. So it just kind of reminded me along those same lines of like, but now this is going to the patients. What gave you guys this idea?
Well, I think part of the challenge of primary care is that it's not reaching that community-based care goal. Part of it is funding, and then, but we have significant inequities in access to primary care. So the idea is to recognize the power of all people and to act together as a collective to protect what we have and make it better, make it right for our community and our family. And the New Zealand project, I've just learned so much about how to tailor and engage by co-creating. So it's that community kind of level where you really get to know somebody and they get to know you, and you put together some ideas. It looks like primary care behavioral health in some ways, but it is reflective of your community and your people.
Yeah, having the patients be a key stakeholder in the whole process is really key. Wow.
Absolutely.
Is there anything else that the audience and anybody who's watching this should know to get excited about this book and what they can expect in it?
Well, the new core competency tools are going to be great for folks, BHCs, and also lots of updated resources, research. I think there's a focused acceptance and commitment therapy toolkit, lots of information about FACT, and I've been using it in trainings as a new toolkit for focused acceptance and commitment therapy. I've become just more and more awed by its power in the hands of behavioral health consultants in the New Zealand project, where we have just amazing results coming. All of the behavioral health consultants, we call them hip improvement practitioners or health improvement practitioners or HIPs, they're all trained in FACT before they go to their clinics. And we just have, we've demonstrated health equity in clinical outcomes. Maori Pacific Islanders are receiving care in numbers that were never seen before. And not only that, but they're about 6 years into scaling up services all over the country. In the past 3 years, rates of suicide have dropped
really?
in the country. Yeah.
Oh, wow.
Yeah. So it's access. You can't break it down. It's not a component study.
Right.
But when you look at implementation, you know, and the results of it, it's really pretty impressive. Other things new in the book, I think we were talking about, we've got top 10 tips for implementers, a new chapter. We've got frequently asked questions.
Nice.
Yeah, one of my favorites. A whole chapter, as I was saying, for trainers with tools for training and competencies for trainers. And for operational folks, a way of kind of starting to define kind of a behavioral health consultant role and a behavioral health consultant 2 role.
Oh.
And yeah, it's a diverse role. It might be specializing in program evaluation, maybe in training and supervision.
Yeah.
Maybe in something else. Yeah, there's lots of options. So, yeah, defining things.
I think that it's very important that anybody who is watching this, especially if you are the sole BHC, or maybe you've been assigned the director because you know you were the first one and you've done a great job as a BHC, there is a place to go. This is not something that you have to make up all on your own. There are experts who've been doing it for 3+ decades, almost 4 decades, and all of that wisdom is found in this book.
Yep.
And I would definitely encourage folks to check that out.
Yep.
And to be able to learn from people who've done it before. You are not alone, and you do not have to create everything and reinvent the wheel. The wheel has been invented many times.
Go to speaktoyourdoctor.com. We put there on the website all of the practice tools, all of the appendices. There's lots of free downloads if you can't afford this book. And it's a big book, but it's got everything in it. It's our biggest baby. Jeff and I have
it looks beautiful.
About 500 pages in there. Yeah, you can get it as an ebook, less cost.
Yeah. You got lots of options.
Yeah, you can buy individual chapters. If one of the chapters I mentioned is of interest, just go to Springer. Yeah.
Awesome. Yeah. Well, thank you so much, Patti, for sharing your baby with the world and trying to make it better.
Yes, and we can do it, Bridget.
Yeah,
we can do it.
Yeah,
Thank
gathering
you.
it all together. All right.
Thanks.
Look at that, perfect timing.